Alcohol, friend or foe to young adults. I am here to address the notion that some tend to think that the minimum drinking age should be lowered. Well, I am not a supporter of that, and by the end of this speech, I hope you will feel the same way. One thing to think about is the new hurdle young adults aged 18 to 25 will be facing. During this stage, it will require a superb use of their cognitive thinking skills. Drinking alcohol at this stage will inhibit a young adult from making the right decisions that will possibly lead to a success later in life. First, I will enlighten you on alcohol and the negative effects it has on the brain and body. Secondly, I will discuss the early adulthood stage and the challenges one may face during this time. Lastly, I will persuade you to see why lowering the minimum drinking age is a recipe for disaster. After a long day at work, or maybe during a celebration of someone's birthday, some adults partake in these moments with an alcoholic drink. An alcoholic drink is a drink that contains the recreational drug ethanol, a type of alcohol produced by fermentation of grains, fruits, or other sources of sugar. Alcohol is a depressant, which in low doses can cause euphoria, an intense feeling of excitement or happiness. It can reduce anxiety, and it can also increase sociability. Alcohol is one of the most widely used recreational drugs in the world. According to the World Health Organization, alcohol consumption is a casual factor in more than 200 disease and injury incidents. With this knowledge, it is my hope that you will agree that the minimum drinking age should not be lowered. Alcohol, or ethanol, its chemical name, is a psychoactive drug. Although its although its instant effects can be somewhat euphoric, the long-term use can be deadly. Alcohol can be addictive, resulting in dependence or withdrawal, causing you to have insomnia, body shakes, or anxiety. There are 7 different stages your body can possibly endure while consuming alcohol. Those stages include sobriety or low level intoxication, euphoria, excitement, confusion, stupor, coma, and sadly, death. Excessive alcohol use is defined as binge drinking, heavy drinking, use by a pregnant woman, or by anyone under the age of 21. According to the CDC, the Center for Disease Control and Prevention, excessive alcohol use is responsible for 88,000 deaths a year. Excessive alcohol use can interfere with how your brain makes memories, meaning it can be possible to wake up with no recollection of what you did the day before you were drinking. Taking on new challenges in life can be daunting, especially for someone in their early adulthood stage. There will be a plethora of new life experiences in the emerging adulthood stage, such as going through a phase of identity exploration where you're trying to define who you are or maybe what profession you aspire to study in. Marriage and future financial decisions are also major factors that young adults need to consider. And while having little life experience, they can find themselves making poor decisions, especially with the ability to purchase alcohol at a moment's notice. Drinking alcohol also increases levels of norepinephrine present in your brain. The neurotransmitter acts as a stimulant, increasing arousal and excitement. It can also lower your inhibitions to increase impulsiveness, making it harder for you to consider potential consequences for your actions. We see the adverse effects of alcohol use. Imagine these same effects being burdened on young adults who still have a lot of things in life to learn. Age requirements are necessary for a number of reasons, which include safety and responsibility. In order to work a full-time job in the U.S., you must be 16 years old. In Texas, the legal age to obtain a driver's license is 16 to 17 years old. You must be 18 to legally purchase a rifle, and due to recent legislative changes, the new legal age to purchase, consume, or sell tobacco is 21. Given the vast privileges that young adults have, It would be in our best interest to keep the legal age to purchase alcohol at 21. Making mistakes is a part of learning and growing as a young adult, but drinking alcohol in the midst of those experiences can lead to an adverse aftermath. In conclusion, the use of alcohol by a responsible adult over the age of 21 is legal and widely accepted. There is no harm in enjoying a Bahama Mama or a martini in moderation. The excessive use of alcohol has all negative factors that lead to chronic illness or death. Giving young adults the opportunity to abuse this psychoactive drug by lowering the minimum drinking age will have many negative outcomes. With the U.S. battling excessive alcohol use in older adults, the number of alcohol-related incidents with younger adults are likely to rise. Therefore, I am opposed to lowering the minimum drinking age.